Good afternoon. I'm Kim Christensen. We're breaking into programming because we're expecting and will be hearing shortly from Governor Polis outside the convention center in downtown, which is now turned into a field hospital. Let's listen
for me,
in.
growing up, convention centers were work. I grew up in a small family business, Blue Mountain Arts. My late grandmother, June Polis, was sales manager, and I worked setting up booths across the country and manning them during trade shows. It was really very powerful for me to see the plans for Exhibit Hall A, Exhibit Hall B. Again, normally for you, for those who come here, it could be work, it could be fun. This is the area where if it's a home and consumer garden show, the hot tubs are here, the outdoor patio furniture is here. Many of you have been here for car shows. But here we have beds and rooms, and visiting that work being done, there's 300 people building out that emergency capacity here at the Denver Convention Center. The conventions are and the trade shows are canceled for many months to come, as you know, and this building and this facility is extremely well situated because it normally has construction and tear down on a regular basis, and now it's simply construction of a different type. Work just began about 48 hours ago. There will be several hundred beds completed by April 18th. 300 people are here at work. 95% of the people doing this work are Coloradans, at least 95% of the people doing this work. And it's an example of Colorado leading the way. We will, if we're successful staying at home, wearing masks when we go out, we will reach the day when once again you can come here for a fun, comic or Star Trek convention or a home and garden show or for work or to purchase the goods you need for your store as a retailer. We know we're not at that day right now, and this facility lends itself to provide that extra capacity we need to relieve some of our hospitals. An update on where we are in Colorado, 6,508 cases, about 1,300 hospitalizations, 241 deaths. Our hearts go out to the families and friends and loved ones of everybody affected. 32,653 people have been tested. And of course we mourn victims of all ages, but to highlight how this virus can strike down anybody in their prime, we lost in the last couple of days 21-year-old Cody Leister, baseball player at Colorado Mesa, graduate of Ridgeview High School in Aurora. And, that also strikes close to home for me and for many people who are baseball fans. Cody was a first baseman. That's my position, too. I'm a first baseman. And I know for anybody who's awaiting baseball season or anything else, just to know that while it's disproportionately impactful for older Coloradans, yes, COVID can and is also fatal at a lower rate for perfectly healthy younger people and can strike down anybody at any time. We also lost 13-year-old Charlotte Figi, a brave advocate for medical cannabis, likely from COVID-19. The virus affects everybody differently, and scientists are trying to understand this now and figure out why some people have mild symptoms or no symptoms, why others are sent to the emergency room and some make it and some don't. We know some of those risk factors. If you have diminished respiratory capacity, if you've been a lifelong smoker, if you're in your 70s or 80s, if you're immunocompromised, but we also know it nevertheless takes a very bad turn for some people who don't have any of those known risk factors, like Cody, like the deputy sheriff that we lost in El Paso County, age 41, just a couple years younger than me, and like so many others. Last week we talked about and unveiled, in kind of the abstract sense, the 4-tier system that we were going to build to deliver the appropriate level of care to patients and surge that critical care. Today we're really showing what that looks like on the ground and showing that that is happening, that we are buying the time we need by staying at home to build this capacity. Tier 1 is the critical care facilities, the hospitals themselves, and I want to thank them. They are all working to expand their beds. They have increased the number of ICU beds, of critical care beds. Hospitals are being flexible with their space, and they're building that ICU capacity. That's limited because they have the facilities they have, they need to have the staffing, they need to have everything in place, but they are working very hard to show some significant increases in that. The second tier is the acute care patients that are stepped down from critical care. That's the ambulatory surgical centers. These are folks that might, in good days, be doing elective surgeries, or some cases even surgeries that have an alternative being done in either ambulatory care or at a hospital. Those are in that tier 2. Freestanding emergency departments, critical access hospitals. Many of our rural hospitals are tier 2 in that we can fill, they can have patients, and many of them have said they're ready for them, they're ready to go. And then tier 3, which is what we have here. This is what we call, the technical term, ambulatory subacute care patients. That's a mouthful, but what that basically means here at the convention center and at other large spaces that are being converted to field hospitals. Some of you might have seen the Central Park Field Hospital. That's where we are. These are used to step down folks from critical care that aren't ready to go home. And I'll talk more about that in a moment, but I want to go over briefly tier 4, which are the non-acute patients, asymptomatic, homeless, folks that have recovered but can't return to a nursing home because they might still be contagious. All of those things we're looking, that's why hotels, dorms, skilled nursing facilities, and others. And I want to thank the Army Corps of Engineers again for their help in building out especially tier 3 and tier 4. Tier 3, we're here today, Convention Center, building several hundred beds by April 18th. The total potential capacity is 2,000. We hope we don't need it. And I know it's a little surreal, being here. First of all, it's empty rather than full. There's people hard at work. There's not, in your experience when you come here, all of the crowds, the enjoyment, the fun, or the responsibilities if you work here in a trade show. But this conversion is an important step to creating the capacity that we need for this medical surge. We expect this facility will be operational in about 2 weeks or so. There's a similar alternative care site in Loveland in the Ranch Complex. And these are to decompress and protect our hospitals. So I don't expect, and I don't think any of us should expect in Colorado, that this facility will ever have to be full. Unfortunately, I also don't expect that it'll be completely empty. I expect that there will be patients that are stepped down here, meaning they no longer require that acute care, and that bed has to be freed up for somebody else. And they can convalesce here, they can be monitored here. This is not a walk-up facility. Nobody shows up here and comes in. These are folks that are in acute care in hospitals. The hospital makes the determination that they no longer need to be in acute care. They can come here. They're monitored by nurses. Oxygen can be administered. We're taking advantage of the regular convention food services, the folks that normally feed people during a convention. That will be here. There's showers. Folks are still contagious. They need to be watched because at any moment the virus could take a turn for the worse, and they may need to be moved to a hospital. But in the meantime, they can get better here. I really hope that we don't have to use this facility at all. I really hope that. And it's also very unlikely that it'll need to be used in a large way. But looking at the numbers, it's certainly possible that there will need to be hundreds of patients here or dozens of patients here that are transferred from the hospitals to free up those beds when they're needed. The saying doesn't go prepare for the best and hope for the best and then get caught flat-footed. We need to prepare for a realistic bad case scenario model in terms of making sure that there are enough beds for those who need that critical access care, and that's what this work is. If Coloradans are doing a good job staying at home, if you're wearing masks when you do need to go out, then this facility will be less used rather than more used. The stay-at-home order is in place statewide through April 26th. That means we have to stay at home except when you need to go out to buy groceries or for your health and wellness to take that walk around the neighborhood with your dog. But we've also created new resources to help Coloradans be successful staying at home. We all know the website covid.colorado.gov. That's very important. That includes the CDPHE's website. But we're now unveiling stayathomeco.colorado.gov, which links to free resources that are available to support Coloradans that stay at home. That will be included wellness, critical services, education, entertainment, so many more things. Stayathomeco.colorado.gov will hopefully, along with whatever you're able to access through cable or dish or whatever you have, books in your home, help make that a little bit more bearable. I want to spotlight one business in particular. Gaia is a local Colorado-based company that's offering free fitness and meditation and healthy cooking classes for kids and adults to enjoy safely, and you can get there through stayathomeco.colorado.gov. There's also a way, if you can provide services for free to your fellow Coloradans in this crisis, you can sign up to do that. Also, helpcoloradonow.org if you're willing to volunteer or contribute for our effort. We added a suggest a resource link. If you know additional free resources, we're not promoting any commercial resources, free resources that any Coloradans with basic internet access can help support them at home and better yourself. We will add it. So we'll build that out. You'll build that out. Please go to stayathomeco.colorado.gov. The webpage gets better the more Coloradans engage. It's your website. We're simply a forum for being able to help share your suggestions of what you can teach for free or do for free that benefits other Coloradans that other Coloradans want to participate in from your home. Other topics to mention, there's also been, as you know, implementation issues with the Federal Small Business Relief Program and the availability of funds. Please call our own Office of Economic Development and International Trade hotline number for 303-860-5881 for assistance. The Colorado Department of Local Affairs Housing awarded more than $1.9 million of emergency help for renter relief to help low-income Coloradans in need of emergency rental and mortgage assistance. That money was just released. And two agencies will also provide assistance to eligible Coloradans in all 64 counties, and that's Salvation Army and Colorado Housing Connects. These emergency awards are expected to serve over 2,000 Coloradans. We've also developed an eviction resources map to help with 211 to help renters avoid conviction. For those at home wondering why all of us here are wearing construction hats, that's because this is a construction zone. Our members of the media and others are all wearing those. It's just to make sure that we can keep everybody safe as well as our masks. Those are some of the updates, and we'll alternate questions. We have some that were just printed out for me and which were submitted by email since we don't have the ability to ask them telephonically. But we'll begin with a question from the room. Mary Ann? Well, we know that the virus will be with us after the stay-at-home is lifted. It is likely to be a part of our future until there is a vaccine or a demonstrably effective treatment. There's several promising treatments that are being tested. I don't know if any of them are that game-changing treatment that would be needed to really change the life-threatening nature of this virus. But there's several clinical trials that Anschutz is involved with. Other doctors are prescribing some therapies that have been promising. But until there's that vaccine or that definitive cure, the virus will be with us. And so we have to figure out two things. One is, how do we function as a society and be able to get back to work and enjoy life more in a sustainable way? We know that people they're not going to be able to be locked down in their homes for many months on end. That's not realistic. What's realistic is we're able to get back to work and earn a living, and that we're able to at least enjoy the Colorado we love a bit more. It likely doesn't mean going to a 20,000-person concert at Pepsi Center or going to a game at Coors Field or necessarily even going to a crowded bar and dance club anytime soon. But what it does mean is that a lot of those retail businesses will be back. people can get a haircut. The salons will be giving them. It might mean there's, one person at a time type protocols. We've got to get back to that as soon as we can. The virus will still be here. People will still get it. The goal of this entire stay-at-home order is not to end the presence of COVID-19 in Colorado or in America. That's not realistic. No health official has said that that's realistic for our country. It might be realistic in a place like New Zealand, where they're an island. They require everybody to quarantine for 14 days when they enter, and they have 40 cases. But America is big and vast. There's areas of our country that aren't even under stay-at-home today. It is extremely unlikely, and no health authority that I've ever heard has ever said that it's realistic to eliminate this virus in America. What it is realistic to do is make sure that we have the medical capacity in place. As you recalled, we used to show those diagrams, Marianne, where it flattens the curve. That means many, many people get this virus in May and June and July. People die from this virus in May and June and July, but it doesn't exceed our healthcare capacity, and those whose lives can be saved by being put on oxygen or at that last step ventilators will have that fighting chance. So you've seen areas that have much higher fatality rates where it's exceeded their ability to provide that, and you've seen other areas where it is still a deadly virus, and especially those who are most vulnerable, but even perfectly healthy people can die from it, but everybody has that fighting chance that we can provide through the medical therapies that we know work. That's where we want to be, and then in a place where we will be able to manage it with a scalpel rather than a mallet, meaning when there is an outbreak, we act quickly, we close down that area, that factory, we isolate people, but you don't quarantine the entire economy in a non-sustainable way. Let me go quickly here. Eric Prater from the Gazette asked, what are the benchmarks that will be determined when stay-at-home will be lifted? How will it be determined without widespread testing? First of all, there's this whole discussion of what is, mass testing, greater scale testing. Does everybody get tested? I don't see a scenario where everybody gets tested. What the scenario is there is much greater testing along with temperature checks, along with the different kinds of testing, meaning the serological testing for the antibodies, the active nasal testing for the virus itself. That will all increase in scale in the coming weeks. And we will have a better sense of where we are 100% on hospitalizations. That's the trailing indicator. But the number of hospitalizations we have in 2 weeks depends on the number of infections that we have today, which we hope is a much lower number, and I'm confident it is, because you are doing a good job staying at home, and that we're doing a good job wearing masks when you absolutely have to go out. Stefan?
The President said earlier today, the President said that most governors he's aware of, they're happy with the federal response. He asked Vice President Pence if that was the case. He nodded yes. Are you satisfied so far with the federal response, and what role do they play in this facility?
Stephen Tubbs asked if we're happy with the federal response. Look, I think in retrospect, everybody wishes that we took this more serious globally earlier, as a country earlier. It would have been possible to prevent it from reaching this stage in our country had we taken earlier steps, restricting travel from Europeans, engaging in more testing earlier. There's evidence that it was in New York as early as late January, early February, probably Colorado sometime in February. We don't know, but it's many people think it was. So the globe, the World Health Organization, the CDC, countries in Europe, America, we all there's been mistakes made across the board, and of course it could have been done better. We have a strong working relationship with the federal government. I spoke with Vice President Pence this morning. I spoke with our entire federal delegation this morning. We're particularly grateful for the work around the Paycheck Protection Program that allows many more businesses to keep people on payroll, and the individual aid that's going out that allow people not to be desperate to have to work. It's effectively the money that we're earning from the federal government to stay at home across our entire country. Stephen Vetter from I-70 asked about reporting in unincorporated communities and why municipalities with fewer than 3 confirmed cases aren't individually listed, cases by zip code or municipality names. Our instructions are we want to be as transparent as possible. This has also come up in the context of race and reporting. If we get it, you'll get it. And we do want to get it. We have already requested additional information from the hospitals with regard to the breakdowns. One of the key pieces of information we would like to have is how many people are discharged, not just how many are hospitalized. We've requested that from the hospital several days ago. We're going to get on them, and we are considering ordering more information closures from the hospitals if they're not providing it to the state and the general public willingly. And among that, I think some of this geography, I'll have to look into what's there and what's not there. I don't know if it's always by zip code, but we try to report that out. We have that county heat map that you see. It's on covid19.colorado.gov. You can look at that. It shows how many cases there are in your county. Of course, I've also seen neighborhood maps in Denver and metropolitan areas that show the heat maps in an even more focused way. Yes? So the Vice President is aware, as is the public, about the outbreak at the JBS facility, and my discussion with the Vice President just ensured that he was aware of the importance of the plant to our national food security, to our farmers and ranchers, and we talked about plans to be able to make sure that that can operate with additional support and safety, steps that are being taken in conjunction with Weld County Health. Sorry? Yeah. The virus will have a significantly higher fatality rate at our nursing homes and care facilities demographically. So people in their 70s and 80s, let me start with the good news. Many will survive it. Most will survive it. 70s, 80s. I read an article about a 106-year-old World War II veteran who beat it and survived it. But the rate of fatality is much higher, 10, 20, 30%. It just depends on the exact health conditions. But it's significantly higher than that 1, 2, 3% that somebody in their 30s or 40s might experience. It's much higher fatality rate. Doesn't mean they catch it easier if you're older. That's not demonstrated. But when you get it, much higher hospitalization rate, much higher fatality rate. Tragically, that will continue, which is why the early steps to keep it out of those centers are so important. Those are likely to continue even after the stay-at-home order ends, well beyond that. In fact, I would even predict that as long as this virus is present and before there's a vaccine or definitive cure, there's likely to be major restrictions on movement in and out of those facilities, meaning real limits on visitation, meaning that it's unlikely to be the whole extended family that can go visit grandma or grandpa in the foreseeable future. One-person visitation, temperature checks. Everybody who entered this facility, when we did our press availabilities at the Emergency Command Operations Center, you all had your temperature taken. I did too. That's why I'm wearing this pink bracelet. It's not because I like pink. It's because I passed and you all are wearing them too. They ask you several questions. They take your temperature. They screen. Those kinds of protocols are what are in place. But keep in mind, by their very nature, lots of people work at these facilities to support our older Coloradans. There's often food and catering. There's supplies. Many of them provide assistance for people to walk around, some medical support. So there is a lot of work at those facilities, and that's why you can't have nobody go in to support our seniors. I mean, they need the support to live, yet, yes, it also increases the risk of anybody come in. But these are, especially those who have that support they need, that is a necessary risk at those facilities because our elderly folks need to be supported. Michael Boothrow asked, The state shows 80% of deaths have been over age 70. Can we target age-specific strategies, and what helps you make these decisions? There are age-specific strategies. Well before the overall stay-at-home order, we had advised folks 60 and up to stay at home. And if you recall, even when the ski resorts were open, before they were closed, we advised folks 60 and up not to go to the high country because of the potential for community spread. We hadn't seen demonstrated community spread, but the high suspicion that there was community spread in places like Eagle County, Pitkin County, potentially Summit County. So yes, there are age-specific warnings, age-specific guidance, age-specific strategies. I would add it's not just those in their 70s and 80s. You might be 45 and have a pre-existing condition. You might have smoked for 20 years and have diminished lung capacity. You might be immunocompromised. All of those folks are also at much higher risk. And even if you're perfectly healthy, you're at risk. But yes, there's additional precautions around those who are most at risk. Who has not asked any? Yes. Well, we have coordinated very closely with Weld County Health to make sure that it can operate in a way that is not putting employees at risk. That's going to include testing, that's going to include cleaning, and we've worked with Weld County Health on the way that can occur, which will prevent additional infection, be safer for workers when they do go back, and can continue to meet the needs of the national food security. I'm going to do one more here, and then we'll go to one final question. Chris, one more from the submitted ones first, then we'll go to your. Chris Vanderveen asked if private labs are not reporting negative test results to the state, making it difficult to determine how much testing is occurring. And the answer is that we're not confident we have 100% of those negative results reported to the state by every lab. Many of the major labs are reporting them. So the number of negative tests is close, but is not fully reflective of every negative test in the state. Final question, is there anybody who's not asked one? Let's go ahead there. Yes. A little louder, please. Thank you. Sí. Sí. Hablé ayer con los ejecutivos del JBS y tenemos una conversación sobre las cosas que ellos deben hacer para mejorar la seguridad de los trabajadores. Ellos van a limpiar todo el lugar y también alquilamos a los trabajadores para el virus antes de regresar al trabajo. Thank you all so much for your questions. We'll do a more traditional press availability shortly, but it was important for everybody to see what's going on here. I hope.
We have been listening to Governor Jared Polis. He is outside the Colorado Convention Center, which is being transformed into a field hospital. They believe it will be up and running April 18th. They said they started on it just 48 hours ago. He talked about the 3 tiers of hospitalization. Of course, our hospitals being the ones available to serve the most seriously and critically ill with coronavirus, but gradually as we step down, he believes we will be living with this virus for many, many months until there is a vaccine. As he said, he is hoping we won't need to use this facility, but he believes we will be seeing people there. He would love for it to remain empty for a while. But as
Which one was number 1?
Well, I'm with Lance.
Okay,
so.
then you come this way.
Oh, he says.
Okay, team number 2 is going to be with Peter. Peter, and we want to give a couple minutes of distance. We can start walking you through what the image means and where we are right now, see what you're scheduled. So team number 2 can come over here. Team number 3. Who was number 3?
News at 4 o'clock, what the governor had to say, what the president had to say, and where we stand on this Good Friday in the coronavirus pandemic. Have a good afternoon. Thank you.